How much it costs to become a mom. 15 countries ranked. For healthcare providers, birthing is less about having a baby than making money from it. The insurmountable joy of parenthood comes with a hefty price tag. The birthing industry generates an estimate of $86 billion in the US alone. This is priceless. The baby is immeasurable. Will it help to know what others are paying to push out their babies? We think it will. Count blessings, hug the insurance provider, do not let go, and read through how much it costs to give birth in these 15 countries. 15. Counting the yen, Japan. Cost 61,810. The figure alone can punch the breath out of a person. According to a report conducted by Coyne College Japan, is the most expensive country to give birth in. The country is considered as the safest country for childbirth, but certainly safety does not come cheap in this case. Japan is 6 times more expensive than the United States of America, which says a lot. 14. Kicked in the buck, America. Cost 10,808. Following Japan, America is the most expensive country to pop a baby or two in. The cost of a normal natural delivery alone is not what makes the ordeal heavy on the pockets. What accounts for a massive portion of the expense is the cost of hospital stay and facility charges, which significantly vary from one state to another. A publication in Health Affairs discusses that a low-risk delivery can amount anywhere between $1,189 to $11,986, excluding cost of OB/GYN or a midwife. 13. Only street food is cheap here, Singapore. Cost $8,045 to $10,195. Singapore has an exceptional standard of living, having the most efficient healthcare system according to Bloomberg. It is also ranked as the 3rd best country for infant mortality rate and safe environment. With these impressive statistics, one might itch to ponder the possibility of giving birth in such an ideal environment. However, it is also one of the most expensive countries for childbirth, excluding citizens who are given benefits and compensation. 12. Up the Duff in Down Under, Australia. Cost $6,775. Australians have a tidy system in place for childbirth. The costs incurred is relative to the system opted, which are public Medicare, private, and home births. The public health system, or Medicare, has the least costs involved, with maximum coverage for ultrasounds, medical tests, prenatal classes, and so on. Out-of-pocket expenses in this system are those involving seeing a special obstetrician. So, basically childbirth will be as good as free of charge in a perfect world, maybe. Add a couple of $100 to the maths? At the expense of zero choice of doctor and long waitings. 11. No Quiding, UK. Cost $4,500. According to Lindo Wing of London's St Mary's Hospital, where Prince Louis Arthur Charles, son to the beloved Prince William and Kate Middleton, was born, a standard room package costs £5,900 and increases up to £6,275, £8,500 for a deluxe suite. But do not fret, this country does not charge a royal fee to deliver a baby. 10. A whole Lotta Loonies, Canada. Cost $3,195 to $5,980. C-section. Warning: the following entry is unapologetically heavy with Canadian slang. There are 2 things Canadians are immediately identified with: their unmatchable niceness, and of course an extremely attractive leader. These Canucks are known for their accommodating nature. The cost of a normal childbirth without complication or C-section is actually free for residents and citizens under OHIP. The costs come into play if the person desires to splurge on comforts of private and semi-private rooms. 9. Does not cost a Skyscraper, UAE. Cost $2,500 to $4,900. The United Arab Emirates is famously known for the glitzy, glamorous Dubai. A trending oasis of multicultures where everything comes at a swift exchange of cha-chings. With such a diverse mixing pot of people calling this country home, the government continuously constructs its laws to meet the demands of everyone alike. The cost of childbirth may vary according to the city, location, type of hospital and the grade of insurance one has. Hospitals in Dubai may charge more for the same services you can have in Sharjah. 8. How the Swiss roll, Switzerland. Cost $7,751 to $9,965. Switzerland is a country that's automatically synonymous with expensive and breathtaking. Both adjectives accurately describing the birthing scene when combined. It will take your breath away knowing the cost of insurance that is necessary to obtain maternity care. Even so, while insurance may not come cheap, it does cover you for the entire length of the pregnancy all the way through postnatal breastfeeding advice. 7. A Dutch bargain. Thuisbevalling, Netherlands. Cost $2,237 to $2,972. Interesting fact: the Netherlands has the highest rate of home births Thuisbevalling in the world. 30% Dutch women have home birth while the rest only transfer to a hospital on need-be basis. The Dutch are averse to unnatural intervention or artificial pain relief. Their women believe childbirth should be as natural as possible, while the pain is only a temporary and necessary biological occurrence. 6. Cheaper by the dozen, Argentina. Cost $1,188 to $1,541. Unlike the customs in Switzerland of home births, Argentinians prefer their children are delivered in a hospital maternity ward. Home births are not a common practice in Argentina, with little choice of doulas or midwives. The cost of childbirth is relative to the healthcare system chosen. Similar to most healthcare systems, the Argentinian system is divided into 3: public, government-funded, private and social security financed. 5. The ever economical China. Cost $701,400. Having the largest population in the world, China definitely knows its baby limits. For a long time the country exercised a one-child-only nationwide policy, which was revised in 2015 to a two-child policy. This means maternity wards are always at maximum capacity even with such a law in place. There are a few practical points to consider before deciding on giving birth in China if you are not a national. 4. How low can it go? South Africa. Cost $1,200. Let's be real, the South African healthcare system, especially maternity, has far too many flaws to overlook. With one of the highest infant mortality rate, this country is under the radar for risky childbirths. A public medical scheme can easily provide a free-of-cost delivery at any government hospital, but the standard of care might leave people feeling anxious and even fearful. Forget the long hours wasted in queues. Hospital staff in South Africa are reportedly rude and even borderline aggressive. According to Medical News Today, there is a significant lack of oversight in and accountability in the healthcare system. 3. Not as Finicky, Finland. Cost $2,500 to $6,800 C-section. This country can do no wrong with its remarkably generous maternity care and laws. Not only does Finland rank as one of the best countries to give birth in, they gift you with a maternity box to start you off. I know, right? This famous maternity box is filled with baby essentials and leaves you feeling like an emoji with gigantic hearts for eyes. The idea behind this box is to give every child an equal start in life regardless of their parents' financial background. Someone hand me a tissue. 2. Operating the Rupee, Pakistan. Cost $1,102 to $1,921. The cost may be seemingly cheap, but with a grievous infant mortality rate, this country may leave the door open to plenty of questions. Pakistan has one of the highest maternal mortality rates in the world. The nationwide trend of doctors calling for emergency C-sections ensures a little extra income towards the hospital and the doctor's personal cut and added stress to the couple. Similar to most countries, the healthcare system is divided into public and private sectors, with majority only able to afford public healthcare. 1. Nothing insurance will not cover, Germany. Cost $1,100 to $7,100. The health insurance will cover all necessary costs of antenatal examinations as well as the cost of prescribed medicines during the pregnancy or at the time of the birth. A statutory health insurance differs from a private health insurance, where statutory insurance will literally pay for everything. A private health insurance will reimburse for a level of coverage agreed upon. Quite literally, there is nothing insurance won't cover, so you reap benefits from your spouse's coverage too.